Once again, I have to say I'm excited to be here. Thank you very much to the Dan Voiculescu Foundation for organizing this. Very proud that our International Longevity Alliance and Vetek Association are the international partners, because what this conference does is exactly what I mean by promoting health and longevity nationally and internationally. That's just a classical example. So what does it exactly that we promote? The basic idea of health and longevity advocacy is that we really need to target aging as a medical condition. We understand that with aging, all the diseases increase in prevalence, in severity, in mortality. So what it means is that we're really serious about preventive medicine for health, longevity, against age-related diseases. We have no choice but to address aging as a medical condition. That may sound trivial, but it's a new paradigm in medicine, new paradigm in biomedical science. That's what we promote. And the idea should be clear during COVID times, when you saw that all the people are the most vulnerable, with the highest severity, highest mortality, which means that also to combat the severe outcome of communicable infectious disease, we have to address aging as a medical condition. That's the main idea of geroscience, that's the main idea of longevity medicine, and that's the main idea of health and longevity advocacy that we represent. And of course, in addressing aging as a medical condition, our explicit goal is not just to extend general longevity, which is also very important. If we value life, we want to live longer, but we also want to live healthier. We want to extend healthy lifespan, or the so-called health span. And in this regard, the situation in Romania is, let's say, not so encouraging. The population in Romania is aging very rapidly and very severely. In 20 years, it could lose about 20% of the population, go down to 15 million people from 19 million, and the percentage of older people can become over 30%. At the same time, the life expectancy and healthy life expectancy in Romania are among the lowest in Europe and in the OECD, about 76 years general life expectancy, 64 years healthy life expectancy, about 8 years less than in Israel, 10 years less than Japan, both values. So this is a call to action, this is a sound of the alarm to really increase the efforts in Romania to increase healthy life expectancy. And for that, you need research, development, and education. There are many proofs of feasibility that yes, it is possible to intervene into aging, to extend healthy longevity, to prevent multiple age-related disease, or so-called multimorbidity. There are several classifications of major aging processes, such as the strategies for engineered negligible senescence by Dr. Aubrey de Grey, who is here, and also other classification systems, such as pillars of aging, hallmarks of aging, which compose major aging processes. And for each major aging process, there are proofs of feasibility that yes, it is possible to intervene to prevent multiple age-related disease. There is proofs of feasibility from animal studies and some emerging human studies, but it is our goal as not just as health professionals, as health scientists, but also as health longevity activists and advocates to help move these studies from the fundamental basic level to the translational and then to the clinical stage, to make those therapies available to people as fast as possible with the highest possible efficacy and safety. That's what we mean by promoting health and longevity, national and international, to help research move quicker to benefit the people. Here are a few more concrete examples of research projects from Israel, from my country, along those lines, along the lines of geroscience, meaning intervention into aging to address multiple age-related conditions, such as epigenetic rejuvenation, stabilizing DNA, vegetative endothelial growth factors that can rejuvenate the cardiovascular system, eliminating senescent cells, mitochondrial replacement therapy. There are multiple directions in this research, but what they have in common is the idea that by intervention to aging, we can promote health and longevity, prevent multiple age-related diseases. That's what we promote. And of course, you cannot treat or prevent something that you cannot diagnose, that you cannot measure. That's why, hand in hand with developing therapies, we have to develop metrics of aging, reliable metrics that will be able not only to predict aging health trajectory, which is a necessary condition for preventive medicine for age-related diseases, but also, even more importantly, to evaluate the effectiveness of putative anti-aging and health span promoting treatments. Otherwise, we'll be selling a lot of snake oil, but with those metrics, with reliable biomarkers of aging, we'll be able to encourage the treatments that actually work. This is a critical scientific task, but also critical political, I would say, even policy and regulatory tasks. Right now, there's no consensus even about what aging means and how it is produced, as we heard from Professor Magilaias. And even in regulation, the problem is worse. We have no idea how to reliably diagnose aging, how to evaluate the effectiveness of treatments. So it will be a massive task, not only for scientists, but for decision makers and policymakers for the future. But hopefully, thanks to such consultations, we'll move one step forward to advance in this mission. Of course, we don't forget about healthy lifestyle promotion, all the things that we know that we have to do but don't always do because we are lazy and human, such as healthy and moderate nutrition, physical exercise, sufficient rest and sleep, very important motivation, the will to live, the reason to extend one's life, very important, probably even more important than the other three components. But alongside the healthy lifestyle promotion, we have to advance science. Some people believe that lifestyle is enough. We don't need all those fancy laboratory tests. When are they going to produce therapies? No, we need both. We need both promoting the healthy lifestyle and science, even for the simple reason that for many older persons, we don't know how to personalize therapy. So if we really want effective treatments, we need more research. And also, through research, we can achieve therapies that may produce results not yet achievable with lifestyle. And for all that, we need research. And for research, we need funding and public support. And of course, we promote health and longevity not just in order to extend the pleasures of the flesh, which is not bad either. I don't mind, but also to develop as human beings. To develop as society, as individuals, because health and longevity corresponds pretty much with every human value, with valuation of life, with economic prosperity, with education, even with equality, with justice. So if you want to promote human development, if you want to advance human values, we have to promote health and longevity as a proxy, as a driver of all the other values. That's why we focus on health and longevity. Of course, there are many other problems in the world. And one of the major values is the economic value. If we're able to extend health and longevity, we'll create massive savings for the healthcare welfare system. It was estimated that by extending one healthy year in the United States, we'll be able to save hundreds of billions of dollars. For countries like Israel and Romania, it could be billions or tens of billions, very substantial for the economy. Of course, there are also indirect economic benefits, such as extending period of productivity, developing biomedical industry, a competitive age. So all these arguments are supposed to influence decision makers, but in my 25 years of advocacy, they not necessarily. What they want to see is the treatments that actually work. So we have to convince that we have to still invest for the long run, even before, even after the next election term. So that's a problem in advocacy, but still that's a barrier we have to overcome. And we do this like any social movement would do, like any advocacy movement would do, by getting people together, by self-organizing, by creating events like this one, by making publications, educating the public, both decision makers and the general public. We have to go both top-down and bottom-up in this advocacy, and that's what we do. Here are some of the examples of events where I was involved and where many people here were involved, including the Longevity Day demonstrations back in 2023, including in Romania, organized by Anton and organized by Alexander Tietz in Germany. So we're creating a movement. It's very important. Longevity will not fall on our lap. We will achieve it by educating, advocating, and creating a movement for it. So it's very important to build up the longevity community, the longevity ecosystem, like we do in our International Longevity Alliance. which now composes 75 non-profit associations from 65 countries. It's very important to build up the community to really make this a global priority, because you know, if 30% of people believe in something, the whole population believes in something. So that's an important step we're making toward this common realization. And here I have to note, and probably it will take me a couple more minutes beyond my talk, a part of the motivation is historical memory. And here I have to say, maybe even in this audience in Romania, not many people are aware about the amazing contribution of Romanian scientists into longevity research. It was mentioned earlier about Anna Aslan's institute being the world's first clinical research institute on gerontology, but actually the contribution extends even earlier to Professor Georgios Marinescu, who was one of the founders of scientific research of aging on a par with Ilia Mechnikov. Was actually an opponent of Ilia Mechnikov in many issues. For example, Mechnikov believed that aging mostly comes from the gut, from intestinal putrefaction. Marinescu believes it comes from the brain, from neurodegeneration. So this controversy still continues. Maybe those views complement each other. The point is, Marinescu was one of the founders of aging research around 120 years ago. Another figure is Anatoly Dimo-Kotsovsky, who worked in Chisinau, which was in the 30s part of Romania. I don't want to go into politically incorrect things, but you know, it's still the same language, so we can still consider him a part of this culture, of this tradition. And that was actually the first analytical institute for research of aging. If Aslan's was the first clinical research institute, it was the first analytical institute, what you would now call think tank, who published the first academic journal on aging called Journal for the Study and Combat of Aging. In Romanian, Journal pentru de combatere, studiere and combatere bătrâneții. I hope I didn't mangle it too much. So that was the world's first scientific journal, and notice the name, for the study and fighting of aging. So the goal even back then was to actually fight aging process, degenerative aging. So I hope we can revive this tradition in our studies as well. Also very important figure beside Anna Aslan is Professor Constantin Ion Parhon, quite an underappreciated figure in some ways. He was actually the founder of the Gerontological Institute back in 1951. And apart from the scientific contribution, even as the discoverer of Gerovital, together with Anna Aslan, he was also the president of the Republic. And as a president, he made an explicit policy to educate for health and longevity. He even introduced the study of aging in schools for little children. He really wanted to educate the Romanian public for the importance of fighting aging, health and longevity. So I hope we can revive this tradition as well. So once again, a part of our motivation is history. And of course, Anna Aslan, the legendary figure, the developer of Gerovital, the Novocaine solution. If you don't know what Gerovital is, it's actually a low-dose Novocaine solutions. People still don't know how exactly it works, but it does in many cases. So once again, an excellent example of proactive intervention for health and longevity, and I hope we continue this tradition. I'll have to run very fast. I have 1 minute and 30 seconds left. So I have to say that, yes, advocacy can bear fruit. Public education, activism can bear fruit. Some examples are the inclusion of aging into the WHO work program that our movement achieved in 2017, the inclusion of aging as a medical condition into the ICD-11, where also our International Longevity Alliance made a considerable contribution. I personally advocated for this since 2012. We petitioned our parliament, the Knesset, back in 2012, requesting to recognize aging as a medical condition, and now we see it's in the ICD. We still don't use it as a medical condition because we don't have metrics, as I said, but at least the direction is there. And that's thanks to advocacy. That's thanks to promotion. And practically what we do is we achieve funding. Without funding, there's simply no research, no education, and no development, because you know, you don't have to explain. People have to eat. You don't think about life extension if you don't know how to survive tomorrow. So it's very important to provide funding, and I'm very proud that thanks to our advocacy, the meetings in the parliament we organized, even public demonstrations, petitions that we wrote, we were able to achieve pretty much all the funding, governmental funding for aging research in Israel came in some way with the contribution of our advocacy. Altogether, it comes to about 24 million euros, about 90 million shekels. Starting from 2015, from the first calls for proposals on the scientific and technological infrastructure for all the persons that we co-created, through international programs such as BIREX Aging, Britain-Israel Research and Academic Exchange Partnership on Aging, where I had the honor to write all the calls for proposals. Now in 2 days, actually on Thursday, we're issuing the third call, multi-million dollar enterprise that involved hundreds of scientists from the UK, from Israel. 13 projects were funded, a very successful initiative. And I focus it here because in the same way as we created this program with the UK, we can create it with Romania. They could be a binational Romanian Israeli program on aging. On Thursday, I will speak with the Minister of Health, Professor Dr.
Alexandru Rogobete.
Alexandru Rogobete, thank you very much for this. And I'll try to raise this idea. Let's see what happens. But at least we can definitely create such international cooperation, and definitely we can increase the support for aging research in Romania, because this subject is vital for the Romanian people, as pretty much for every people in the world. And I hope, thanks to all our efforts, which can be scaled indefinitely, we can all enjoy health and longevity for us and for our loved ones. And thank you for this opportunity to promote it again. Thank you.